All right, this is Women's Wednesday.
And as usual, Dr. Daniel Rousso is in the house. Tracy Haynes talked to him about lip augmentation.
Welcome in, everyone. Dr. Rousso is with us again today, and we're glad to have you, sir. Today the subject is lips.
Yeah, today we're talking about lips and how they can be changed and altered to help patients as the aging process continues. The lips, we know, typically will get smaller as we age. And so there are a number of things that we have now that can improve that. And also, if someone has a traumatic injury, if they lost a piece of the lip or something, we can do some things to improve that. All these different techniques we have to alter the lips.
All right, TV people have a notoriously narrow field of reference. So Angelina Jolie, there, I said it. Okay, and if we've got her picture's up now. She's somebody who's noted for her lips. And actually, I think what some people remember is before she really started paying attention to her lips, and she's someone who had kind of moderate size to very full lips now. You've seen that. Do patients come to you and say, I've seen her and I want to look like that? I mean, do you get those kind of conversations?
Definitely, absolutely. Patients will see her, or they want to look exactly like her, or they'll say they don't want to look like her, exactly like her, but they want to look a little bit more, and so they'll use that as a reference point. You're exactly right. So we'll do some things that can change the lips based on what the problem is. If a patient has a very, very narrow lip and they want to elevate the lip and they're really very aged, we have to do some things that are fairly dramatic by making an incision along the lip line and lifting the lip up. But that's fairly unusual. We don't typically do that. Most of the time, people just want to get a subtle improvement. They want some definition along the lip line. They want to improve little vertical lines that typically women will get to, that the lipstick will bleed into. And so we use some injectable fillers, things like collagen-type products that have been around.
You have there are some ethnicities, African Americans, or just anybody from that African line period, and certain groups of Asians and all who have the full lips, from day one. Do you get people who say, I don't want my lips quite this full, I want to narrow that down? Do you get any of that at all?
Yes, absolutely. There are some that really do have too much lip, and they want them smaller. Right. And it's the reverse. We'll actually make a little incision on the inside of the lip that's hidden. It's hidden on the inside, and we'll remove a little strip of skin. It's a very simple procedure to do, and you can reduce the size of the lips.
And as you said earlier while we were talking, you have 4 or 5 different techniques that you can use to change the lips and give your client a more pleasing appearance.
Absolutely. Of course, the fillers that we have now, the collagen-type fillers, are temporary. They last for a period of months, maybe 6 months to a year, and then they're gone. But we do have now some interesting permanent solutions. We have an implant that literally is like a breast implant. It's a saline-filled implant that's about the size of a small, narrow cigarette, and you can slip it into the lip and fill it with some saline, and it's permanent.
How about this? If we've got a viewer who's thinking about having some kind of a procedure like that done, if there's one key thing you want them to remember or think about before they contact you, what do you want them to know or think about?
Well, I think they need to make a decision about what they would like to see. If they can bring us pictures of movie stars, that's actually very helpful, and then they can let us know, what they're interested in.
Understood. Dr. Rousso, the best way to get in touch with you?
Call the office at 930-9595 or our website at drrousso.com.
Okay, we need to explore that website some more, too. Fascinating place. Dr. Rousso, always glad to have you in.
That's glad to be here, Tracy. Thank you.
Excellent. All right, we'll take a break, and we've got more coming up in a second. Stay with us.